All good to go? G'day, Gary. Oh, good afternoon, everyone. Thank you for coming. I can confirm that WA has recorded 10 cases of COVID-19 overnight. Those 10 are the crew from the Stolt Sakura tanker that the Premier outlined in his update yesterday. This means WA's total case numbers is now 1,109. There are a few COVID-19 issues that I can brief you on today, so stand by. Firstly, with regards to the Stolt Sakura, the Department of Health have tested all crew for COVID-19, with 12 of the 22 returning positive results. So I said before, 2 were recorded yesterday in yesterday's figures, and a further 10 are included in today's official numbers. There is currently 6 patients from the Stolt Sakura in Fiona Stanley Hospital. As you know, 4 crew members were disembarked and transferred to hospital over Saturday and Sunday. Overnight, a further 2 crew members were removed from the vessel and taken to Fiona Stanley Hospital. Police assisted with the escorts and no incidents were reported. WA Health advised that 2 of these patients are now in ICU in a serious but stable condition. The other 4 are being managed in the respiratory ward and are in a stable condition also. At this stage, all other crew members will remain in isolation on board the vessel unless they need to be transferred for medical treatment. 8 crew members are fully vaccinated for COVID-19. Of those, only 1 is among the positive cases and remains on board. In regards to the diplomat that arrived in Perth from Serbia via Dubai on the 29th of September, our contact tracing team and police have identified 10 close contacts of the official so far. 9 of the close contacts have now returned a negative result. 1 contact, who is a family member, is also now positive and will be reported in tomorrow's official numbers. They are all now in hotel quarantine. The other close contacts include employees at the apartment complex, a driver who transported the family from the airport, and a passenger who sat near the diplomat on the flight into Perth, and a family of 4 who entered the lift shortly after the diplomat and his family. All close contacts are in quarantine, where they will remain for 14 days. Our health authorities advise that this is an extremely low public health risk, but we're not taking any chances, and all precautions are being taken just to make sure we keep everyone safe. Over the weekend, WA was informed that Adelaide Airport has been listed as an exposure site on the South Australian website. 157 passengers travelling on the VA 722 on the 1st of October from Adelaide to Perth were identified as casual contacts. WA Health has commenced follow-up and testing of these contacts, with 18 returning a negative result so far. All travellers have been contacted directly and instructed to get tested and isolate until they return a negative result. I'm advised that the risk is low, but it is important if anyone who has been contacted follows the instructions from the Department of Health and make sure that they do the right thing. Now to vaccinations. 4,430 vaccinations were administered in walk-ins at Clermont during the Royal Show this week. This week there are 4,000 appointments available at Clermont, 4,300 at Joondalup and 1,000 at the CBD clinic. So please, go to the Roll Up for WA website and make your booking. Today, a new pop-up walk-in vaccination clinic at Headland opens. The clinic is open between 8 AM and 8 PM from today until Sunday, October the 10th. COVID vaccines are available across the state at our state-run vaccination clinics, participating GPs and pharmacists. Getting vaccinated is our only way out of the pandemic. Don't hesitate. Don't be that person who says, "I wish I got it done earlier." book today, because once Delta arrives, it's too late. Make sure you get yourself vaccinated as a matter of urgency. Any questions?
So the 10, my maths is not good. So it's 22 all up. So now it's just 10 all up off the ship.
12 all up on the ship, some of whom have been evacuated, yeah.
Can I ask you, I mean, on the subject of vaccination,
Yep.
why is it that the least performing local government area when it comes to getting vaccinated is yours?
Well, it's interesting, isn't it? It comes down to, really comes down to this question of convenience as well. People say, well, the vaccines aren't convenient. Well, as you know, we've got a big vaccination clinic right in the middle of the city of Kwinana. So it's troubling that we still have low vaccination rates, even where people have a vaccination clinic on their doorstep. I've been letterboxing and imploring the people of Kwinana to make sure they get themselves vaccinated. But Kwinana represents all the social demographics and the sort of LGAs where we are struggling to get our vaccination rates up.
The time is set it done. What's wrong with it that just encourage those people that are hesitant or just can't be bothered to get on?
Well, you would have heard from the Prime Minister last week, where he's now saying in November we're looking to open up the international borders. And you see the situation in Victoria, where people are saying, people are in ICU asking to be vaccinated. It's too late by then. It's too late. Delta will come into our lives in Western Australia, and it's too late after it arrives to get yourself vaccinated. So get yourself vaccinated today.
Then why don't you just say to people, so I know that the Premier's message is, if you want to travel, if you want to do this, get vaccinated, okay? Those people have probably already gone and got vaccinated months ago. So why don't you take the next step and say, if you're not vaccinated by this date, you can't do this, that, or the other.
And I think we'll get there in due course, Gary. At the moment, we're encouraging people to get vaccinated. We've obviously got a range of mandatory vaccination programs in play. And as of the 1st of October, our first tier of healthcare workers have come into that mandatory regime. And as a result of that, we are now in the very high 90s. 90 percentiles in relation to a lot of those cohorts. So as this progresses, you will see higher numbers start to be vaccinated, and we're on the right trajectory. If you look at the way where we're travelling at the moment in terms of our forward bookings and the onward trajectory of bookings of vaccinations in the primary care sector, we are on track to get that fully 80% vaccinated towards the end of the year. But we need to get onto it. We need people to do the right thing and get themselves vaccinated now.
I've been listening to that for weeks and weeks and weeks, that it's up to people to do the right thing, and you're not doing it. We're a bit of a laughing stock when it comes to this. So the rest of the country looks at us. I know we've got no COVID, but they look at our vaccination rates and they're appalling.
Well, they look at the freedoms that we enjoy. They look at the grand final, which was held here just a fortnight ago, and they think that Western Australia is in an enviable position. Now, one of the reasons why there is so much hesitancy is because people don't feel necessarily under pressure because there is no COVID in our community. Now, we're not going to introduce COVID in the community. People are doing the right thing, getting themselves vaccinated, but we do need to lift those rates.
Why don't you take it to that step where you say, here's a date like everywhere else is doing. Here's a date that you've got to aim at. If you don't go to that date, then you are going to suffer some consequences. Right? It's over, but your lifestyle's going to have to change.
And there will be consequences as a result of people not getting themselves vaccinated as we get towards those higher numbers. At the moment, our aim and our objective is to get as many people vaccinated as possible by both through encouraging people, through our advertising campaigns, making sure that all those people who do get captured under mandatory regimes understand their obligations. And push will come to shove at some point in the future, and we just want people to continue to move forward.
About 80 to 90%, and he's not talking about after Christmas. So when do you think push will come to shove?
Well, I'm not going to differ from the Premier's point of view in relation to this. 80 to 90% is the target that we want to see people getting themselves those vaccination rates.
Is there any modelling for when you actually reach that vote? Amy Robertson said in her estimates that we haven't seen any modelling for reaching it 5%, but that's what we need to get to.
Look, I received a briefing from the vaccination commander the other day, and that's why I say at the moment, if we look at our forward bookings in our COVID clinics, in addition to the trajectory that we are seeing in relation to the primary care sector, we will hit those numbers in late November, early December. But we also now have Moderna coming into our pharmacies. I haven't seen official reports, but anecdotally, there's looking like a good uptake in relation to that. So the situation should continue to improve.
Now we've got the right bloke as the vaccination commissioner, a
Commander?
charismatic bloke like Chris Dawson, he can't get the numbers moving.
Well, I think he is charismatic, and I think he's doing a great job. He's in Headland today to really champion the Vaxathon that they're doing in Headland to get people vaccinated. That was very effective strategy in Broome, and so we're looking to similar success in Headland today.
Do you understand that there will be people out there that feel like they've been sort of held back because of the ones that just can't be bothered? Don't you sense that, responsible people have done the right thing and now listening to our Premier talking towards Easter next year?
Well, I don't think they feel they're being held back. In Western...
I personally feel held back. You don't think there's a lot of people out there that feel they're being held back?
Well, it depends what you mean if you feel held back. If it's because you can't travel internationally, well, obviously that's not an option for any of us, regardless of our vaccination rate. If you're allowing that to happen. If you let me finish. So if you're talking about being held back, that people won't be able to travel internationally, we all have that in common at the moment. If you're talking about the opportunity to travel to Victoria or New South Wales, I don't think that's high on people's agenda at the moment. But if you're talking about the opportunity to be able to go to a pub or a restaurant, go to large venues and so on, not have the restrictions of wearing a mask, in Western Australia we have the greatest freedoms of just about any state in Australia and potentially anywhere in the world. Now, in the future, we will need to have a situation whereby we have our borders play less of a role in terms of our public health social measures. And at that time, we want to make sure we have very high vaccination rates, but that time will come, and it's towards the end of the year, as the Premier has said, and at the moment, our trajectory around vaccination rates will get us there, but we want to get there as quickly as possible.
And that will mean reintroducing masks where there'll be restrictions on that.
Yeah, and that's an important point to make. We need to have a public conversation about what it looks like when those borders come down completely. It means in Western Australia that we'll be looking again towards masks playing a role in our lives. We will need to look again to potentially limiting the number of people at particular venues, pubs, restaurants, large venues and so on. So, I mean, it will be a challenging time, but the only time we can confront that is once we have very high vaccination rates.
Can I ask you about the regional communities vaccination, remote communities, indigenous communities?
Yeah.
Is it likely that we'll get to that point where you get 80%, but you're going to have to lock down whole regions or whole communities?
Look, my experience in relation to some of these communities is that they are making progress in many of them, but there's some where, quite simply, we will not get vaccines into those communities. So ultimately, we may be in a situation where they have to stay locked away, either under the Biosecurity Act or other legal measures, to make sure we protect those communities. In time, I hope they come on board, and I think they will, but just at the moment, it's become too difficult. So our efforts are focused upon those communities where the leaders in those communities do accept the importance of protecting their members of their communities, do accept that the vaccine is safe, do accept that it's effective, and do accept that it's going to be an important part of protecting everyone. Okay, so there are ventilators which are attached to ICU beds, and obviously we have many of those right throughout our hospital systems. So it's around about 111 of standalone ICU beds. In addition to that, I think we have another 330 ventilators, although I'll get you the exact numbers, and they're ready to be deployed where we need them. Well, they're all in standby. Essentially, they're probably in a health support services warehouse in Jandakot, and they'll be deployed where they need to be. That's correct. Yes, I mean, we certainly, I don't have the exact numbers off the top of my head, but we have a significant number of ventilators. Understanding that once you're intubating someone, they're in serious condition. And it's our fervent hope that we won't have to use all those ventilators. They were purchased at a time when ventilators were the standard operating procedure for assisting someone who is in a bad way. But now we've got much more antivirals, steroid-based drugs and anti-inflammatory drugs so that we can avoid intubating people, because the outcomes for someone who's intubated are very poor.
So the next question that we have with
So they can be deployed at a moment's notice and used wherever they need to be. So if you imagine a situation, for instance, where you have an outbreak in Broome and you've got some patients being transferred to Broome Hospital into general beds, you deploy ventilators to that region in case those patients then require ICU treatment. So we're ready to go in relation to that. We have protocols in place around the deployment of this sort of equipment. We have protocols in place around the deployment of staff as well, which is another aspect of our COVID response system. I'm very confident, and these were all pieces of work that we undertook in 2020 as part of our ongoing preparedness. And the Department of Health and the WA Country Health Service are very confident of the processes and protocols we have in place.
Is there any consideration, I heard something about leavers as to how you're going to deal with that in terms of vaccination amongst teenagers?
No, it's been considered by the Chief Health Officer actively, as we and we had a discussion about that today. We may have some more announcements about that in the short term.
The suggestion is that a national double jab, we may not be able to attend a leavers area like Dunsborough or something.
Yeah, I'm not sure what the obviously I'm not going to second guess what the Chief Health Officer decides in relation to that. But obviously having levers in one place at one time represents a great vaccination opportunity as well. But we want to make sure that people are coming together in these sort of venues in a particularly socially intense mixture, that obviously getting themselves protected against COVID is an important consideration.
So there could be some restrictions put on it in some way, the numbers or what they have to have, is it required?
Yeah, as I said, the Chief Health Officer is looking at that issue right as we speak.
Do you think the low vaccination rates in some of those communities discussed will hold back the 80% or 80-90% reopening, or will you just move ahead and that will be enough?
No, look, I think at some point in the future we'll have to form a view about whether we can include them as part of the overall cohort. And as I said, if necessary, we will simply protect those communities physically if we can't protect them medically through the vaccine. My understanding is that it has, and I'll be very, very happy to provide a briefing in relation to that workforce and ventilator modelling which is being done, and what the expectations are.
Can I just ask you another issue? The British emerged with two young men who snapped into Oxford Stadium for grand final press on security guards. How concerning is that?
Look, these are big venues, and security is uppermost in obviously the operator's mind at all times. And there's always going to be some clown that wants to try and get in under the fence or over the fence or under disguise. But obviously, you know, the Optus Stadium and all these big venues continue to make sure that they improve their security.
I'm surprised to see how easy that has been.
I've seen the fence there, so that surprised me that they got in so easily. But I'm sure that they'll be looking at those things.
When is Ashwari's report?
Look, we expect the report in the coming weeks. The process that we will go through as part of that inquiry will be the department and the health service provider will be asked to agree the facts of the investigation, and obviously we will provide that report and a briefing to the family before we go public.
Just personally, from your point of view, I know the Premier said yesterday, discussion around this graph you had, wouldn't that be a better thing to do, to put families through a protracted legal dispute?
Of course, of course, yeah.
And are you considering that?
Well, we haven't had those conversations yet, but let's get the inquiry through first, and we'll continue to work with the family as we have been ever since this incident occurred. Well, we have already been recruiting, and as you'd be aware, that we've recruited a number of nurses, over 200 doctors as well from the UK and Ireland. That's right, yeah, and we'll be released. And those recruitment drives are still ongoing. We've got a communications aspect of that campaign, which we'll be releasing very shortly. Oh, my understanding is material has been developed. No, I don't think so. As I said, we've had over 200 doctors now come into Western Australia. We've had over 750 nurses recruited since January this year. We have got a graduate nurse intake of 1,290 this year, with another 1,200 next year. So there's a lot of work being undertaken to make sure that we're continuing to grow our health workforce. A workforce not only to deal with the current demand on our hospital system, but also in anticipation of the demand on our system once ultimately we have Delta in our community. So we need to continue to make sure that we grow the health workforce. Nurse graduates are really important because they provide fresh blood to the system, but we also need those tried and true skills of experienced nurses to come into the workforce as well.
Can I just ask you one more question? Do you think having a date that you have to adhere to will make a difference in terms of that vaccination?
Let me make this observation. Under the mandatory regimes that we've put in place to date, where we said aged care workers had to be vaccinated by the 17th of September. When we made that announcement, we were in about the mid-80s. By the time that date came around, we were in the high 90s. Same for the first tier one of healthcare workers. So I understand that people say a date will be effective in making sure that we can push those numbers up, but we are still continuing to vaccinate over 10,000 people a day. We're still getting good growth in those numbers, and all states are looking towards the end of the year in terms of agreeing protocols between borders and so on. And so that's a good date for us to aim for.
Do you get a bit personally weary of all the criticism of you as health minister and the way that you're handling all of this?
Not at all. I think the government enjoys great support
Well,
from.
I'm saying personally, you. I mean, it's thrown a lot. People don't like the way you've done things.
Well, look, a lot of people agree that we've done a great job, to be honest. I think they think we're working under very trying circumstances. They see the situation in the other states, where those hospital systems as well are under a great deal of pressure. They see other states where they see COVID-19 run rampant in the communities. They look to Western Australia and they say, sure, times are tough. Sure, it's hard not being able to be with family and to be able to travel, but I'd rather be in Western Australia than any other part of the world.
So you don't listen to those critics, only to those who praise you?
We've got a plan. We're pressing on with that plan, and we're seeing it work. Well, as you know, Jeff, I've been out here for many days, weeks, and months now, telling you every day about how we're continuing to keep COVID under control, how we're continuing to make sure that we expand the capacity of our health services in our hospitals to make sure that we've got the staff and the beds we need. We see those things working, and I think the people of Western Australia appreciate that.
Guys, last question.
85% is now this figure where you've got this 10% grey area. Where's that come from, the 80 and 90? Is that from the chief health officer?
Well, look, there's a range of commentary that goes on at the moment in terms of the national plan, the New South Wales plan around 70%, which they then changed. We've seen other states look at other numbers. What we're saying is at the moment, there's only one thing people in Western Australia need to be concerned about, and that's getting themselves, their family and their friends vaccinated. As we move to higher numbers and we see the spread of that vaccine across the community and in particular parts of the community, we'll be in a position then to move forward in relation to making decisions around other aspects.
Is that the chief health officer saying 80 to 90%?
Well, yes, absolutely. With certainly 80% of 12 and over. Other states are just looking at 16 and over. So there's a little bit of colour and movement in this space at the moment. For Western Australia, the need and the objective at the moment is quite straightforward. Get yourself vaccinated, protect yourself, protect your family, and let's get on with continuing to improve the Western Australian community. Well, the opposition and the AMA have been saying that all along. We've proved them wrong in 2020, we're proving them wrong in 2021. Thanks.